Hello, my name is Monica Perdomo. I am a second-year medical student at the Charles E. Schmidt College of Medicine. This research will focus on the COVID-19 and mental health, specifically its impact on patients diagnosed with substance use disorder. The research was conducted under the guidance of the principal investigator, Dr. Jimena Levy, as well as my fellow classmates Elena Kelly and Monica Espinoza. Dr. Christy Slinsky was integral to this research as she contributed the data from the Rural Life Treatment Center. As we all know, the COVID-19 pandemic has taken many lives throughout this year. However, the effects of this pandemic are not just in its death toll. Due to the variety of changes that have occurred as a result of this deadly virus, the mental health of the population at large has been impacted. Stress, anxiety, and depression have all been on the rise during the pandemic. Fear of the unknown, socioeconomic crisis, and social isolation are all factors that have contributed to this pervasive anxiety plaguing many communities. Of note, in this poster, we will be discussing the impact of this pandemic on those diagnosed with substance use disorder in the Royal Life Treatment Center in Washington State. Substance use disorders are defined as behaviors that arise when a person continues to use a substance despite the negative consequences related to its use, as per the DSM-5. These consequences can include adverse health effects and social impairment. Substance use disorders have been known to co-occur with mental disorders at a higher rate than by chance alone, as was seen in an examination by the National Epidemiologic Survey on Alcohol and Related Conditions. Those with pre-existing psychiatric medical conditions, such as those diagnosed with substance use disorders, have also shown more symptoms of anxiety and stress during the pandemic. Based on these observations, we hypothesized that the rates of depression and anxiety would be greater in substance use disorder treatment patients in 2020 during the height of the pandemic. Furthermore, this research is incredibly important because higher rates of depression and anxiety in these patients has been associated with an increased rate in suicide and relapse rates. So for our research, we conducted an analysis of de-identified data from the electronic medical records of the Rural Life Treatment Center in Washington State. This data covered the period from March to August in 2019 and March to August in 2020. There was a total of 1,112 patients included in our data set, of which 575 were from the year 2019 and 537 were from the year of 2020. The Beck Anxiety Index and the Beck Depression Index were used to assess the levels of anxiety and depression in these patients. Scores were calculated by finding the sum of the 21 items in their intake assessment. The interpretation of these scores can be seen on these tables located to the right of the methods section. The self-reported depression, report of self-destructive thoughts, engagement in self-harm behavior, and suicide attempts were also analyzed. Comparisons were analyzed with descriptive statistics using SPSS 25 for Mac. Frequencies and descriptive statistics were evaluated. Pearson's chi-square test was used to determine statistically significant differences between the categories in the contingency tables. Below, you will find bar graphs demonstrating the results of our research. Patients treated during March to August of 2019 and 2020 were included in this analysis, as was previously mentioned. The mean anxiety index for those in 2019 was shown to be 32.02, as can be seen on this bar graph. And for 2020, the mean Beck Anxiety Index was shown to be 29.85. This had a p-value of 0.05. The mean depression in the Beck Depression Index of 2019 was 32.03 and 32.15 in the year 2020, with a p-value of 0.91. As you can see, this data was not statistically significant. However, as you can see on the table on the right, self-reported depression was seen in 55% of those in 2019 and 45% in those in 2020, with a p-value of 0.7. 0.07. Contrary to these previous results, self-destructive thoughts were higher in 2020 than they were in 2019. In 2020, 61% of patients reported self-destructive thoughts, whereas in the year 2019, only 38% were reporting self-destructive thoughts, with a p-value of 0.02. However, actual engagement in self-harm was 64% in 2019 and 36% in the year 2020, with a p-value of 0.01. As can be seen by this data, there is no statistical difference between the scores of anxiety and depression in patients with substance use disorder before and during the pandemic. The data showed that self-destructive thoughts were higher in 2020 than they were in 2019. However, the actual engagement in self-harm behaviors and attempts was lower, and suicide attempts was lower in 2019 than in 2020. Additional research is needed to be able to make generalizable conclusions about this population as an effect of the COVID-19 pandemic. Limitations of these conclusions include the fact that this is a snapshot of the population. This data only includes those that were in treatment at the Royal Life Treatment Center in Washington State, and it is not representative of the United States as a whole, as can be seen by the table, the demographics seen on the table. These demographics are not representative of the population in the United States. Furthermore, other than a larger sample, we would also need data on those that were not able to find treatment during this pandemic. Analysis of the mental health data for substance use disorder patients without access to treatment centers is urgently needed. We hypothesize that this population that does not have access to healthcare is at a greater risk of having higher rates of anxiety and depressions because of the socioeconomic crisis that has occurred due to the COVID-19 pandemic. Lastly, there were no cases of COVID-19 reported in the treatment centers. This may be due to very strict screening processes at the time of the admissions. Also, there was strict isolation for those in the detox centers, and there was strict control of exposure of the employees working in the center. Thank you so much for listening to this poster. I would like to send my thanks to Dr. Jimena Levy and her mentorship. Her mentorship was integral in finishing this poster and doing this research. Thank you so much. Have a great rest of your day.